Healthcare has gone through a massive revolution since the time of COVID. And one thing that's actually going to change of the entire healthcare system is telemedicine. Do you think that the future of telemedicine is expected to see continued growth?
Telemedicine gives access of healthcare providers to a lot of patients.
Oh, healthcare has gone through a massive revolution since the time of COVID. Now, there has been a lot of changes that has happened in the healthcare industry. And one thing that's actually going to change of the entire healthcare system is telemedicine. In simple terms, telemedicine is actually the delivery of healthcare services through information, communication, and technology. It helps to treat, diagnose, monitor either through video conferencing or through phone calls.
Right.
Now, do you think that the future of telemedicine is expected to see continued growth in the healthcare segment?
See, of course, I do feel that because post-COVID, there has been a very, very high adoption of technology within the normal people. The general people, the smartphone penetration has increased manifold, data has become very cheap, and that is definitely going to promote the widespread use of telemedicine. Now, it again depends on the hospitals and the healthcare providers as to how much ahead of the curve they are able to keep themselves in adopting this revolutionary way of reaching out to new patients.
Just to add to it, there is an increased adoption as more and more patients are actually becoming aware of it and they're choosing the telemedicine way. So just to add to it, with the advent of telemedicines, there is an increased adoption because patients are becoming aware about this certain facility. Patients which are in the remote areas, they do not have to compromise on their health right now. The expertise, medical expertise can actually reach out to them and better care can be provided to them. So there is an increased possibility of better healthcare, better quality. With the advent of AI, screenings can be more accurate, more better, more precise. Revenue can be increased because right now it's just not about patients coming to the hospitals, but it's also the periphery becomes larger. With the help of telemedicines, you can actually cater to one and all. And an approach where individual patients can be given that importance. And of course, with the advent of telemedicine and AI and data records are there with the healthcare facilities. So the records can also be, with the advent of data, things can be checked. And there are on-record data as well. So I think the scope is much larger and it only gives to a positive outcome with telemedicine actually becoming the future of healthcare, because more and more patients can take advantage of this. And this is, I believe this is the way out.
See, I think that we also need to approach this with a bit of caution because it's a double-edged sword. Of course, as you rightly said, that the pros of adopting any new technology and something which is very vital in healthcare, because telemedicine gives access of healthcare providers to a lot of patients whom they didn't have access to. Now that, from a healthcare provider's perspective, increases their revenue, increases their efficiency of time, so on and so forth. And also from the patient's end, they have the convenience of reaching out to the healthcare professionals from the comfort and convenience of their home. And this is primarily important for people who are not in the vicinity of a good healthcare facility and so on and so forth. So the pros are lots. Also with digitization of their complete healthcare records, which the government of India is also in the process of legalizing, it definitely has a lot of pros. However, it also has a lot of challenges in implementation, which we should be careful about.
So you think there are misses to it as well?
Of course it is. Any new technology would also be have its own negatives, would also have to be used with some caution in mind.
Okay.
One of them being that the security of data, right? Because whenever you are trying to digitize the complete health records of an individual, whenever you are trying to have access to a health between a healthcare provider and a patient purely through a digital media, there's a high chance of their digital records getting hacked. So that is something that needs to be taken care of. Secondly, in that case, a lot of prominence would have to be given on the digital infrastructure. Because when there's a patient who's based out in the villages or in the rural background,
Internet connectivity might be an issue.
exactly.
Yeah.
So when they're completely dependent on a healthcare provider who's just going to have access to them
Yes.
through a digital media channel, that is something that needs to be, hugely taken care of. So the government also has to ensure, or the private companies have to ensure, that the digital infrastructure in the most rural of the places are taken care of. Right, so these are certain things which we would need to take care of. Now, of course, even in the pros side, with technologies like AI, with technologies like digital variables, AI variables, of course, you can remotely have access to how a patient is doing. But that also, poses a challenge, that if there is a technical challenge with the variable product, then there's going to be a huge issue in the way the healthcare provider is able to get records of the patient. Second, another point where we need to have a caution, because telemedicine can only be used for some basic diagnosis.
Yeah.
You still need, a person-to-person interaction when it comes to complex cases.
Yeah.
Right. So we also need to have a balanced approach, wherein the quality of the relationship that a healthcare provider builds with a patient doesn't deteriorate beyond a point due to the adoption of telemedicine. So I guess these are both pros and cons that we need to take.
Yeah, you know what, and little more now, since that you're talking on the minuses, what I also believe is that, for example, a healthcare facility, just by providing, the concept of telemedicine or promoting telemedicine, they also need to make sure that there are certain physical labs out there where examinations, the quality of examinations is proper, because a lot of remote villages and areas do not have the proper infrastructure as well. Sometimes the sonography machine is not working or something of that kind. So in that case, the health again gets compromised. Now again, if you remember, when the e-commerce boom happened, a lot of physical stores were actually thinking, oh, are we going to make sales? Are people going to come to us? What is going to happen to us? But then we also saw that while a lot of population is doing things online, buying online, are taking complete advantage of the e-commerce thingy, but a lot of them are also, not comfortable shopping online, because they miss the comfort of touch and feel. Now, even here, there are certain times when a doctor is diagnosing, but that comfort of in-person interaction with the doctor vis-a-vis an online interaction with the doctor, where let's say I have a stomach issue, where the doctor is not able to see which part of the stomach is I'm facing the trouble. That is again one more grey area. Now I do not know if AI does something, a sensor or something, which also gives that communication or gives that prompt sensory motion to the doctor, which makes him understand what's going on. I think these are certain things, that if taken care of, it can be. So here the biggest question then lies is that, in that case, looking at all the things, is telemedicine going to be the king of healthcare in the future times, or it's going to work hand in hand with physical consultations too? Now that's a question. I think that's needed to be answered. Yeah. What do you think?
Right, so I, as you rightly said, but I don't believe that telemedicine would be the king of the upcoming trends. But yes, it will definitely be a very, very important arm of reaching out to newer patients of basic diagnosis for the healthcare providers. I also see this initial trend would be first adopted by the urban population, and then when the tertiary infrastructure is developed, then maybe the rural adoption will take place, because right now even the most of the urban population hasn't adopted to this. So once that happens, only then we can expect the rural population to change, because whatever mindset they have had, they have built this mindset over centuries. That is not going to change within a very, very short span of time. But yes, this has a lot of advantages, specifically even in the urban areas where people have very, very busy schedules. They have a dearth of time, right? And they want to also have a more efficient utilization of their time. This also poses advantages for healthcare providers, because they can efficiently diagnose more patients. But I see beyond a point, people or patients would have to go and visit doctors physically when the diagnosis becomes a bit complex. So yes, to answer your question, this will always be used in conjunction with physical diagnosis and physical treatments like surgeries and all that going forward.
Well, even I think the same way. I think that the healthcare providers right now should look at telemedicine also to cater to a larger audience, and this definitely opens the door for healthcare marketing.
Definitely.
And a new window completely opens up, and communication can be at a different level altogether. Well, these are our thoughts. Let us know, what are your thoughts on telemedicine? Do you think that this is something which is going to rule healthcare, or this is something that it's going to work side by side with physical consultation? We would await your feedback on the same. Let us know in the comments.